For people that have more of a low income or challenging budget, we will work with them the best that we can. We have resources that we can provide for Medicaid, but our specialty and what we do best is private pay. But we definitely work with them as close as possible to help find a placement for them however we can.
Hi, I'm Susan Kassen, and I have a guest here today, a special guest. This is Jill Murawski with Senior Living Specialist. Tell us a little bit about yourself and what Senior Living Specialist does.
Thank you, Susan, for having me. So, Senior Living Specialist, we are a local senior referral company. So what that means is we help families that are in need of placing their loved ones in senior living. And that could be anything from a 55 plus apartment to assisted living, memory care, even independent living. And so we work with families and help the best that we can to place their loved ones, and we consult and advise them through the entire process.
Yeah, so one of the reasons that I wanted to have you here today to talk to you is because it seems like more and more my clients are running into these kind of situations, or myself and my family members are at an age where a lot of people I know are getting to that point where we need to decide, where to place our loved ones because of, medical situations, or just, they want to downsize. It could be a financial reason. So tell me a little bit about, are most of the people that come to you, like how many are in a crisis mode and how many are just kind of trying to plan for the future?
Well, I would say in a perfect world, we would love to be on the early part of the planning process. But I would say realistically, most of the time that we are helping families, it's in crisis.
Right.
So their loved one could have had a fall over the weekend. They could have had a stroke. So a lot of times, unfortunately, it is crisis. But I will say the one thing that I think really differentiates us compared to a lot of companies out there, especially some of the the bigger companies, is that we really are a 7-day-a-week, 24/7 company. We have people on call every weekend because that's usually when situations happen.
It always happens on the weekend.
We can do a turnaround pretty quickly in a day.
Yeah.
If we need to.
Okay.
So I really like to pride ourselves of that, that we can assist and guide families, and we do it very well.
Right. And I think one of the reasons that when we first started talking about different situations is that, everyone has their own, every situation is different. And so,
Exactly.
Do you work with people from all different financial backgrounds, financial needs? How do you, and I would assume also medical needs, like what kind of assessments what kind of questions do you ask, and what are you looking for when you assess the situation?
That is a good question. So it's a little complicated. We have over 22 people on our team. And so we have a number of people that are marketing, number of people that are placement. I am part of the administrative team. And I wear a number of hats in what I do, but we do work together and collaborate together the best that we can. So several of my teammates that are on placement will actually go and assess if the person's at home or whether at the rehab or even the hospital to kind of assess the situation. We also have 3 social workers on our team. So we're able to do our best to get the exact clinicals. Now, as far as finances are concerned, that's also when it gets tricky because unfortunately, most of the places that we would place somebody is going to be private pay. And private pay, oftentimes somebody might have a long-term care insurance. So there's lots of details that go along with that. For people that have more of a low income or challenging budget, we will work with them the best that we can. We have resources that we can provide for Medicaid, but our specialty and what we do best is private pay. But we definitely work with them as close as possible to help find a placement for them however we can.
Right. And I'm assuming you have the resources available to at least answer the questions, because
Absolutely.
there's so many questions and there's so much information that nobody even knew that they needed to know until it was time to know it. And then it's like an emergency.
And you don't know what you don't know.
Right.
So our whole process, a lot of it is educating families.
Mm-hmm.
And we also cover the entire Metroplex and the surroundings. So we've got a team that's in Tarrant County, and then we've got a team that's in Collin County, Dallas County. And so things are going to be different as far as finances and budget.
Mm-hmm.
So we try to work with the families on their budget, location, and absolutely care.
Right.
So we try those three criteria is what we work with, and try to give them a minimum number and not overwhelm them with options.
Right.
And of course, working with the timeline,
Mm-hmm.
whatever that might be.
And so I know, how long has your company been in business?
Since 2008.
Okay. So I'm assuming they have a lot of relationships that they have built over the years. So it's kind of like when you get a call in, you would almost know, a handful of places you could place somebody just from
Oh, absolutely.
just from the
From the experience and the
Yeah.
relationships, we've been in the business since 2008. I actually met the owner, Paul Markowitz, shortly after that. And he helped me with my mother in 2010. We had to place her in a residential care home. She had Alzheimer's. And we were in crisis. My dad had just passed away, and so we were able to find a place for her. And it definitely helped in that situation very much. But through that time, since 2008, fast forward now, we work with over 1,500 communities throughout the Metroplex, and as well as residential care homes. So we have helped over 15,000 families since 2008.
Wow, that's a lot.
Now that doesn't mean we've placed that many families,
Mhm.
but we have touched that many families and worked with them and collaborated with them and have built relationships with them and the communities that we work with.
Right. And I think what I like, what you've told me is that, you can go anywhere from a over 55 independent senior living apartment to a residential care home, which is a lot of times it's hard for people to know about those or to find them because they don't really advertise. They're not on a highway somewhere where you can see a big sign.
Exactly.
But they could be in your own neighborhood that you live in and you
Yes.
might not know, but you're aware of where most of those residential care homes.
Absolutely. And that's part of my job, actually, at least in the Collin, Dallas County area. And we have a team, as I said, in Tarrant County, but we definitely take the time to tour and vet these residential care homes.
Mm-hmm.
In fact, I'm doing that this afternoon. I'm going to tour. So we want to build the relationship. We want to get our eyes on the living space. We want to get to know the caregivers and the owners so that we can entrust that they're going to care for the families that we're referring to.
Right.
With the care that they have committed to. Definitely.
Do you ever recommend that maybe somebody stay in their own personal home, but then you have resources for people that could come help care for them?
Well, that's a
in their
great
own
question.
personal home?
And a lot of people, most people want to stay in their home as long as they can.
Mhm.
Most people aren't waiting until they're a certain age to go move to a senior community, right? So we definitely work with families on their timeline. And if they want to stay home, but they know that their loved one needs care, then you kind of have to weigh what the care needs are. And we definitely have resources to refer care agencies, so people that come into your home. And again, it depends on what the care needs are. So that can be a nice alternative until somebody's ready to move.
Right.
There's sometimes respite is a good option.
Mm-hmm.
So they could maybe place their loved one in a community or a care home for while they go on a trip or for just a week, just to see how they do.
Right.
And that's another great option.
And then you're kind of familiar with that so that
Yes.
if there is a situation, it's not quite as big of an emergency.
Right.
Because you've already kind of dipped your big toe into a certain type of living situation, and then you might feel more comfortable later on
Absolutely.
placing your loved one
I think the families Many families, of course, are hesitant. We deal a lot with adult children. And if there's more than one and you've got multiple siblings, it can get kind of interesting. So trying to get everybody on the same page, of course, is our hope. And just communicating and helping them be advocates for their loved one. And there are people out there that don't have family. There are people out there totally on their own, and we have resources to help advocate for them as well, to help put in place so that they can get guardianship, whatever they need to do, so they are represented respectfully. Yeah.
So tell us how we find out, how we get in touch with you or someone at your company. What's the best way?
So the best way is our website is seniorlivingspecialists.com. And it is plural, specialists. Paul Markowitz is the owner. And then, of course, myself, Jill. And Jill at seniorlivingspecialists.com.
Okay. And we'll probably put some information in the show notes so that people can see that when they go onto our channel.
Wonderful.
We hope that you like and subscribe our channel so you can get more content that we'll be bringing you with great resources in the area like Jill.
Thank you.
And thank you all for joining us.
Thank you for having me.
Thank you.